Smoking, a pervasive habit with well-documented health risks, remains a leading cause of preventable death worldwide. Despite decades of anti-smoking campaigns and legislation aimed at reducing its prevalence, the World Health Organization, WHO, reports that tobacco kills more than 8 million people each year. More than 7 million of those deaths are the result of direct tobacco use, while around 1.2 million are due to non-smokers being exposed to secondhand smoke. The familiar narrative surrounding smoking focuses on its direct health consequences, such as lung cancer, heart disease, and stroke. However, the impact of smoking extends beyond individual health, affecting society in profound yet less discussed ways. This article seeks to shed light on these often overlooked dimensions, offering a broader perspective on the toll of tobacco. One of the less recognized effects of smoking is its environmental impact. Cigarette butts are the most common form of plastic waste globally, with an estimated 4.5 trillion discarded annually. These filters contain cellulose acetate, a type of plastic that can take over a decade to decompose. Moreover, the process of growing tobacco contributes to deforestation, water pollution, and the use of hazardous chemicals, further exacerbating environmental degradation. Another significant but underexplored aspect is the economic burden of smoking on healthcare systems and economies at large. Smoking-related diseases account for a substantial portion of healthcare spending in many countries. In the United States alone, smoking-related illness costs exceed $300 billion a year, including nearly $170 billion in direct medical care for adults and more than $156 billion in lost productivity due to premature death and exposure to secondhand smoke. These figures highlight the economic strain that smoking places on societies, diverting resources that could be used for other critical needs. Moreover, smoking has a disproportionate impact on marginalized communities, a facet of the smoking epidemic that receives limited attention. Lower-income populations and certain racial and ethnic groups have higher smoking rates and suffer more significantly from tobacco-related health disparities. Factors contributing to this include targeted advertising by tobacco companies, limited access to cessation resources, and the stressors associated with social and economic disadvantage. In exploring solutions to the smoking epidemic, public health efforts have evolved to include not only traditional cessation programs, but also innovative strategies like harm reduction. This approach acknowledges the difficulty of quitting smoking and seeks to minimize its health risks when cessation is not immediately feasible. Products such as e-cigarettes, while controversial, represent a shift towards harm reduction, aiming to provide smokers with less harmful alternatives to combustible tobacco. The fight against smoking is multifaceted, requiring a comprehensive strategy that addresses its health, environmental, economic, and social dimensions. Effective measures include stricter regulation of tobacco products, increased taxes on cigarettes, bans on advertising, and more accessible smoking cessation programs. Equally important is the need for a societal shift in perception, recognizing and addressing the broader impacts of smoking on communities and the environment. The global smoking epidemic is not just a story of health lost, but also of broader societal and environmental impacts that often go unnoticed. By broadening the conversation beyond the immediate health effects, we can mobilize more comprehensive and effective responses to one of the most significant public health challenges of our time.